I think it's a combination of two words. Doc means, I think, connected to health, doctors, and Brella is umbrella. So it's an umbrella under which all the healthcare information, services, consultation and data, all that can be put into one system and one what they just showed, the Medi-Locker. So healthcare is today, there is so much of information available and so many facilities, hospitals, all kinds of hospitals are there, all kinds of treatments are there, and for somebody who is not well, sometimes it can become very confusing what decision to take. And also at the same time, there is sometimes due to wrong information or not lack of information, wrong decisions can be made, or they can even be exploited also, because sometimes people go to some hospitals and when they don't know anything, they can be put through unnecessary procedures and unnecessary treatments also. So this is a very, it's part of the issue that we are facing, especially because the cost of expenditure has gone so high, and people end up spending a lot of money. And if it is done for the right purpose, then there is no problem. But sometimes when they are misguided, then that becomes a huge problem. And many of people really end up suffering. One is wrong or poor diagnosis, the other thing is wrong or unnecessary procedures, or sometimes when they are just put through unnecessary, for the sake of commercialization of today, because hospital and medical care has become so commercial also, that they get exploited so that the hospitals can generate more revenue. So these are all the various issues, challenges. And for a person, I think for Docbrella to really become a landmark, application, software application, and an app that can be used by everybody, is how they can connect all these things. It's not going to be very easy, because you have to earn the trust of people, because healthcare is something where people are it's very personal. So they want to, be able to earn that trust also is quite a challenge. And how the system is going to work, how the advice is going to be given, how the protection of data is going to be ensured, and you also include AI into this, so that AI can look into all the information and make suggestions. So these are all a lot of new ways of doing things has also been brought in. So I think I wish you all the very best, and I hope that you succeed, because it is something that is a need, but I think it will require the right combination of proper expertise, proper ease, good ease of access, ease of using the system, and to be able to generate the trust. And I'm happy that you've chosen Karnataka to launch this project, and coming from Odisha, you come over here. Starting from over here, Karnataka is the IT capital of the country, and all the research and advanced learning and latest methods of doing things, innovation is always encouraged in Karnataka and Bengaluru, and that atmosphere is already there. So this is the right place for you to launch this, and if everything works well, then like you said, it can become part of each and every family across the country. So the healthcare databases, they contain data regarding the health of the patients, the vulnerabilities, what kind of tests they've undergone, what kind of treatments they have undergone. This naturally expresses itself as an invitation to attack. If a person, say, knows some XYZ whose records have been accessed, medical records, what kind of illnesses that person is predisposed to, what is the genetic constitution, what treatments has he taken, this information can be then sold to insurance companies in the background, which can then fashion a customized insurance around him without him telling. That apart, the other aspect of health which is vulnerable to cyber attacks are the health devices, the pacemakers, you have automatic insulin injectors, and you've got many other wearable devices that tell you about, that continuously won't feeding you about your health status. Many of us have that. So these are accessed by some attacker. Then that person has the access to entire your health information
on a day-to-day basis. Thirdly, the other form of attack that healthcare sector is vulnerable to is the ransomware attack, which is a very invidious and insiders kind of a cyber attack that we have in these days. They will simply come and lock the databases or the servers where the data is stored, and that generally, deprives the healthcare, the people who are managing the database to access it. And simply explain, ransomware is nothing, but in Hindi we call it Tale pe Tala. You've got it, your database is very well made, very secure, very good firewalls, rules, strong WAFs and all that is installed. But all that the attacker has to come and do is to put a small lock over your door.